You are watching the DocTalk show.
Okay, welcome back. We are discussing diabetes. In particular, it's important to know that this is the World Diabetes Month, and this week we are happy to host executive members from the Uganda Diabetes Association, that is Dr. Piloya Teresa and Dr. Lumu William, who are here to raise awareness about diabetes. So just before we broke off, we were discussing the risk factors that can predispose someone to getting this disease called diabetes. I'll start with Dr. Williams. Are there some factors that can result in this diabetes disease?
Yeah, in adults, there are a number of factors that can predispose one to diabetes. One is the age. 45, if you have above 45 years of age, you're at risk. But in Uganda, we're even seeing people younger than 45. We're seeing a lot of diabetes in people about 35 years. The other risk factor is the family history. If somebody has diabetes in the family, mother, father, brother, the first degree relatives have diabetes, you're at 5 times more at risk of getting diabetes. If somebody is obese, of course, in hospitals we measure the BMI. But simply put, if you put on size 40 inches around the waist, you are likely to be more at risk. And the obesity we are talking about is the central obesity, the fat around your tummy, not around your behind, but around the tummy.
So if you also have high levels of cholesterol in your blood, so cholesterol is fat in your blood, when we measure your blood and you have high levels, it can put you at risk of getting diabetes. And of course, stress increasingly. Now, those are new emerging factors that are being studied and are thought to cause diabetes. Sleep deprivation. So if you're thinking that you'll work very late and wake up very early, however small you are, you may actually be predisposed to getting diabetes.
Okay, so these are very, very important risk factors for people to be aware about, so that when they modify their living their lifestyles, they can prevent diabetes in the long run. Dr. Lumo, I've heard of a condition called a prediabetes. What exactly does it mean?
Okay, prediabetes is a condition. There are 2 issues in here. Sometimes we measure blood sugar in the morning before you have eaten anything. That blood sugar is supposed to be less certain value. In this case, we are talking about less than 5.5. Now, for somebody to be diabetic, we do your blood sugar in the fasted state, and it's more than 7 on 2 or more occasions, then you are diabetic. But then there are times you do a fasting blood sugar for somebody. It's not less than 5.5, it's not above 7, but somewhere in between, 6.1, 6.5, 6.9.
It's not yet at the level where you say diabetes. One is diabetic, but it's also above what should be the normal.
So that's what we call impaired fasting glucose.
Okay.
Then there's also another category. Sometimes we send patients to go to the lab. And when they go to the lab, they go in their fast. When they are fasted, they give them a glucose solution to drink. And then they start measuring their blood sugar, and they've just gone to the lab at 1 hour and at 2 hours. Now at 2 hours, somebody's blood sugar should be less than 7.8. And to diagnose diabetes, if you do somebody's 2-hour value after drinking that glucose solution, and it's more than 11.1, that is diabetes.
That is diabetes.
But there's times when it's 9, it's 8, 10, it's not normal, but at the same time, it's not diabetes.
So that is called the
impaired glucose tolerance.
Okay.
Now, the impaired glucose tolerance and the impaired fasting glucose, which we already alluded to, constitute what they call pre-diabetes.
Pre-diabetes,
meaning
and can
that
also cause the diabetes.
So if somebody has any of those 2 conditions, or both of them, is at risk of getting diabetes.
Okay. How can someone tell that they might be getting diabetes?
So all in all, when you have diabetes, majority of the people may actually be asymptomatic in adults.
And where symptomatic would mean?
They don't have symptoms. They are
they're just
moving
normal.
around. They're just normal.
Yeah.
That's for adults. But children, and actually, if you spend long with your diabetes, the commonest symptoms we see, there will be excessive urination. They will be going to the toilet at night, waking up more than 4 times in the night to go to the toilet. And for children, if they had stopped bedwetting, they will begin to bedwet again. And of course, parents would get worried and they would think that the child is being naughty, but that could be a sign of diabetes. And then excessive thirst, they feel they want to drink water, they lose weight. So if someone was gaining weight, all of a sudden they begin to lose weight, they might think they're actually losing true weight, but sometimes if you're losing weight and you also have no energy, that could be a sign of diabetes. And they crave, they ever hungry, you're ever hungry.
Another could be body itching of the body. Sometimes people get recurrent infections, things like candida. People can get repeated candida infections, skin abscesses, boils. That could be a symptom of diabetes. Others may have poor wound healing, pricking, burning, pins and needles, numbness in the feet or in the body, and impotence for men. Actually, in our research, we found that 40% of men who have impotence later on, it's a sign of diabetes.
Okay, so these are the actual signs that someone might be having diabetes.
And of course, blurring of vision. We've had so many people first going to the eye clinics to be fixed, only to be found that they have diabetes.
For if a child is not seen, unlike adults, you might live with it for some 6 more months. It might give you time. It will buy time. For children, it won't buy time. They will die. They will go into a coma and will die. However, for adults, because it buys time, they're producing some insulin, as we said initially, they will go on to get complications. So, and the complications, think of any part of your body, you will get complications.
Any part of
Any
the
part
body.
of the body.
Because diabetes hits everywhere.
Everywhere. Everywhere. So what you will see, you will actually see, for the eyes, they will start getting problems with the eyes and they will eventually be blind if nothing is done. You continue lingering around, you may get blind. For the kidney, it's the commonest cause of kidney failure in our country and commonest cause of dialysis. So if nothing is done, they will need a transplant.
So dialysis would mean like an artificial machine which works like a kidney.
Yes.
Because the kidneys have stopped working.
Exactly.
Okay.
And then heart disease, it's the commonest cause of heart attacks world over.
The other complication is a stroke. A stroke is when you get part of your brain being dysfunctional and you get weakness on one side of the body. So that's one of the other complications. Diabetes can affect one's nerves that supply the stomach and the gut. And once that one happens, they get bloating. Bloating means you eat something little and your stomach balloons with gas. You can have a heartburn. Some people have diarrhea, most especially at night. Others develop constipation as a complication of diabetes. Okay. Others actually develop urine retention. Their bladders become numb. As to where they become numb.
They become numb? What do
I mean by numb?
Yes.
They are not functioning normally as they are supposed to. So when urine comes, it corrects in the bladder, and the bladder fails to sense that actually there is urine, and they get urinary retention. Other complications for women, because I've already talked about gestational diabetes, they can have recurrent losses of their babies in utero, frequent abortions, frequent deaths of children in utero.
If we are able to detect the diabetes early enough, we can bring it under control and prevent some of these unwanted complications. So remember, you can send in your comments, your questions on our social media platforms on Facebook, Twitter, and we shall respond to each of your questions. And just after the break, we shall come back and discuss more about how exactly to manage diabetes if you're diabetic, and if you're not, how can you prevent yourself from getting diabetes.
You are watching the DocTalk Show.